Welcome to Physician Focus. I'm Dr. John Fromson. The mass killings in Aurora, Colorado and Newtown, Connecticut in 2012 and the Washington Navy Yard in 2013 are the latest in a long list of mass shootings in the U.S. that captures the nation's attention and troubles the nation's conscience. These and other senseless acts also serve to raise alarms about the link between mental illness and violence. In recent Gallup polls, nearly half of Americans, 48%, blame the mental health system a great deal for mass shootings, specifically for the failure of the mental health system to identify individuals who are a danger to others. This edition of Physician Focus will explore the topics of mental illness and violence. We'll look at such questions as, are mental illness and violence connected? If they are, how are they connected? What is the healthcare provider's role in addressing potentially violent behavior? And what might the mental health community do to aid in reducing violent acts? With me for this discussion are Dr. John C. Bradley and Dr. Michael Tang. Dr. Bradley, a retired colonel in the United States Army, is Chief of Psychiatry and Deputy Director of Mental Health of the Veterans Administration, Boston Healthcare System, and a clinical professor of psychiatry at the Uniformed Services University School of Medicine. Dr. Tang is a psychiatry resident at Harvard South Shore Psychiatry, a program of Harvard Medical School. Welcome. It's really great to have you here.
Thank you, John. It's great to be here.
We really look forward to talking about this topic that is so much in the news and sadly can affect us all individually. And I guess I wanted to begin by perhaps defining what violence actually is. There's so many forms of violence. It can begin on one level with bullying, all the way up to those horrific instances that we just mentioned before, like Aurora, Colorado, and Newtown, Connecticut. I think it would be really beneficial to our viewers if we just talked a little bit about defining violence, what violence really is.
Well, maybe I should take a stab at that. You know, violence occurs on a spectrum of behaviors, like you mentioned, from bullying all the way up to murder. And, you know, we characterize violence in a number of different ways. There are intentional acts of violence and unintentional acts or non-premeditated acts, sort of impulsive acts. And in the intentional realm, there's violence directed toward other people and violence directed toward oneself. You know, we have to look at suicide as a form of violence, particularly when we're talking about mental illness. But violence toward other people can take many different forms, from simple assault to right up to lethal forms of violence that we hear about in the news.
Sure. And there seems to be a link between mental illness and violence. And there may actually even be misperceptions about what that link really is. For example, you know, you read or you hear a lot about, you know, people that are mentally ill are going to be much more violent than the general population. What is that link between mental illness and violence? You
know, that link is really unclear. You know, a common misperception is that people with mental illness are prone to violence. What we really know is that people with mental illness are much more likely to be victims of violence than perpetrators of violence. But for those people with mental illness who are prone to violence, they tend to be people who are not receiving mental health care. That seems to be one of the independent risk factors for engaging in violent behavior, not receiving treatment that would otherwise be effective at managing your symptoms and managing any potential for violence.
Sure, and certainly mental illness also is a very, very broad term. I mean, there's so many different diagnostic entities under the umbrella of mental illness, you know, from depression to manic depression to schizophrenia to anxiety to post-traumatic stress. Is there any link between any specific diagnosis and violence?
That's a much more difficult question to tease apart. And when we start to look at perpetrators of violence who also happen to have mental illness, mood disorders such as bipolar illness in particular and psychotic disorders like schizophrenia seem to be much more likely to result in violence, particularly when those conditions are untreated. If you look at prison populations, for example, those conditions are much overrepresented in a prison population.
John, I really appreciate you also, mentioning about suicide as being a form of violence, and certainly I know when we, address our patients, we're usually very concerned. For example, if there's a history of depression, if there's a history of past suicide attempts, if there's a chronic medical illness or chronic pain, or social major problems like a divorce or a death or something like that, are those risk factors for suicide, for someone hurting themselves or being violent toward themselves? Are they also risk factors for violence towards other people?
Well, the single greatest predictor for violent behavior is a past history of violent behavior, irrespective of any presence of mental illness. So that's the single most important factor to take a look at when we're evaluating a person or looking retrospectively at somebody who's committed a violent act. Has there been a history of violence that might be evidence that they're prone to violent acts in the future? And we all know that violence occurs more frequently in impoverished areas, low socioeconomic areas, and people who engage in violent behaviors are more likely to have suffered abuse as a child, physical abuse and other forms of violent behavior and exposures. So those are some risk factors that lead to violent behaviors, and they're much more closely related to the risk of violence than the presence or absence of a mental illness.
Oh, that's a very important factor. Yes, Mike.
And I think adding on to what Dr. Bradley was saying in terms of patients with mood disorders or schizophrenia might be more prone to violence. Also, studies have shown that there's some statistical significance, which means that that's not happening by chance, that patients who are suffering from both a serious mental illness and a substance use disorder that's kind of caused more, they're more prone to have violence as well. So substance use disorder is definitely a big issue as well.
Sure. But I think it's important you raise that issue about the early stages of development, and if somebody's exposed to or has been a victim or survivor of violence, the chance of them doing it again is a lot greater, particularly in a domestic type violence setting.
Well, that's a really important point, and we also want to take a look at who are the potential victims of violence. In the news, we hear about sensational stories of sort of mass violence or random acts of violence, but the fact remains that most violence occurs within a family or household setting. Well over half of violent incidents, including murders, occur within the context of a home. The next likely category of perpetrator to victim relationship are friends, but very few. I think maybe 1 in 6 or 1 in 7 violent acts occur between strangers.
Following up on Mike's comment about the use of substances, drugs and alcohol, are drugs and alcohol usually present in most types of adult or young adult type of violent behavior?
Of the mental illnesses, intoxication and substance use disorders are extraordinarily related to acts of violence. And so that's something to really pay attention to as an independent risk factor, and as something that as physicians we would want to evaluate our patients when we do our risk assessments.
Sure. So adding along with what Dr. Bradley was saying, in terms of a survey they done nationally in 2011, they estimate about 5% of the general population suffers from serious mental illness, and 22% of which actually has a substance use disorder in addition to that mental illness as well. It's a serious mental illness. So I think it plays a big part.
Sure. And in terms of cultural factors, is violence towards others something that you see in all cultures? You mentioned, John, just about how important socioeconomic conditions are in terms of a culture of poverty, but around the world, is this part of the human condition, do you think?
I believe it is. When we look across cultures, there's violence that occurs in all cultures. It does take different forms depending on some of the cultural norms, access to weapons, and the like. So there are distinguishing factors between countries, but there's no country that's really immune from violence and murder.
So it seems like we were able to identify here some early warning signs or things that you as clinicians watch out for, the history of violence in the past, substance use, and being brought up in a family where the currency of exchange is one of violence. Right. And I wanted to move along and help our audience dispel some myths that there may be about violence.
Well, I think one of the biggest myths we'd like to dispel is that violence occurs because of mental illness. We see in the news frequently in some of the more sensational cases where there is a suspected mental illness, but the vast majority of violence that occurs happens outside the context of any mental illness playing a part. That violence is part of the human condition, and that mental illness can play a role. But when we look at the statistics, it only plays a minor role in propelling people toward acting on violent impulses.
Okay, so that's myth number one, that mental illness is not always the cause of violence.
That's right.
Any other myths about violence?
Well, some of the other myths are about these episodes of mass violence, that it's almost universally somebody with a mental illness that perpetrates them. But when you look at and dig into those episodes, some of them do occur as perpetrators with mental illness, but many do not. Okay,
maybe we can move on in terms of whether or not the mental health system has failed or not. If there are a small percentage of people that participate in these horrific crimes, and we hear very often that they couldn't get the treatment that they received, or that there weren't any inpatient psychiatric beds available, has the system, do you think, failed these people?
I would say that the system has not failed. One of the challenges is that very few people with mental illness actually receive care for their diagnosis. Only about a third of people with a mental illness actually do receive care, and many of those receive care from their primary care doctors, who may or may not be aware of screening for risk factors for suicide and risk factors for violent behavior as well. So I think one of the challenges is to recognize that people with mental illnesses should refer themselves for treatment. The treatment's effective, treatment's available, but we really need to overcome the stigma and barriers to care.
Yeah, I certainly share that perspective. I mean, if you have diabetes, you seek help. If you have high blood pressure, you seek help. You take appropriate medications for that. But it's so hard in our society. It's almost seen as a sign of weakness. I think particularly for men, to get help for these things, as opposed to that it's a sign of strength. And I think that's probably one of the big barriers. I think also some of the mental health issues, such as depression and post-traumatic stress, those things by themselves are barriers to getting help. Very often a depressed person won't have energy and will be isolated. Those with post-traumatic stress can be very isolated as well too.
That's right.
And the issue in and of itself is a prevention or a barrier.
Right. Sometimes the illness itself can prevent you from thinking that you need help, or thinking that treatment will actually provide some benefit.
Sure.
So that's a major barrier that we really have to overcome. And you mentioned that some people believe that there's a moral or character weakness associated with mental illness. And what we really need people to understand is that mental illnesses are brain diseases. Just like diabetes or hypertension are physical illnesses, so are mental illnesses. They just happen to have emotional and behavioral and functional impairments associated with them. So if we can change people's perspective on that and recognize that these are illnesses that respond very well to treatment, and the treatment is available, hopefully we can turn the tide.
Great. You know, so much of what we hear in the news about these horrific mass killings and the aftermath from these, you know, is associated with firearms and mental illness. And I wanted to ask you, as experts, do you have opinions or thoughts about the connection between those two?
It's indisputable that the most profound episodes of mass violence use firearms. You know, there are other episodes that occur with explosives and the like, but what you hear about in the news are those that happen as a result of a person using a firearm to create mayhem and take many lives. There's a clear association with access to firearms, and what we know is that access to firearms, particularly if somebody is prone to violence, is an independent risk factor. And we have more firearms in the United States than we have people. And while we could debate about the Second Amendment, I think what we really ought to focus on is how access to firearms is a risk factor both for suicide and for homicide. What people may not realize is that having a firearm in your home is twice as likely to result in death by suicide as it is in homicide. And so we really need to raise awareness about this connection, about access to firearms, and importantly, the question about who should have access and whether people with a violent history, which I think is really where we need to focus, ought to continue to have access to firearms, irrespective of mental illness. I think many people might have a fantasy, and this fantasy might actually worsen stigma and bias, that if people who had a diagnosis of mental illness didn't have access to firearms, that the rates would go down, when really it's the question of a violent proclivity rather than a mental illness.
Absolutely, and I think too, you know, you raised in a very important point for our viewers. You know, the people that are at highest risk for violent suicide are men who are old, who have a gun, and who are drinking. Mm-hmm. You know, it's an awful perfect storm for something like that to happen. So we've learned through your expertise here that most violence is not committed by people with mental illness, and that raises the whole issue of prevention. Are there individual, community, family, even strategies in terms of helping to reduce the incidence of violence?
That's a great question, and you know, to answer that, I think we need to look at multiple levels. We need to look at community strategies to reduce violence, as well as individual perspectives in identifying individuals at risk. On the community front, I think we're a culture that's very comfortable with violence, and certainly in more urban environments, where children see firearms and violence on a daily basis, you become somewhat immune to it and watch the violence increase. At the individual level, it's very, very difficult to predict who are the people who will be prone to violence and who are those who won't. And screening for mental illness is not helpful in that regard. And we get back to looking at those individual risk factors about a history of violent behavior, exposure to violence in the past, physical abuse, and importantly, substance use disorders and intoxication, which often disinhibit people and tip the scales toward acting on violent thoughts.
Sure. I'd like to ask both of you, you know, almost on a daily basis, you know, we're hearing about wars going on throughout the planet. We hear about mass shootings and killings, and how can we react or deal with that avalanche of daily doses of violence, even in fiction, in terms of watching TV shows or you know, movies and theaters? The violence, video games, is such a part of our everyday life, it seems. How do we cope with that, and how does that affect us? Does it have a bad effect?
Well, I think what we see is that people react very strongly when there is an episode of mass violence. And communities and individuals become outraged, as we should. We shouldn't tolerate violence in our society. It's all too ubiquitous, though. And so we tend to react with outrage and often overreact, wishing that there's something we can do to really eliminate the risk of violence in our society. I think I don't have any answers in terms of how we can turn the tide on our acceptance of violence in our culture. It's pervasive in media, in daily life, and in many communities. But we really ought to take a stand and think about how we can turn the tide. I think it's going to take more than mental health professionals thinking about this question, but really society at large wrestling with this and wrestling with this connection between mental illness and the potential for violence.
You certainly raised the issue too, John, about the media. What role does the media have to play in this? What role is daily dosing in repeatedly, have on people? Does the media need to take some sort of responsibility by filtering these episodes or describing them in a way that's not going to be traumatic?
I think so. I think the media has an important role to play. Certainly these stories are sensational when they occur, and so the media feels compelled to cover them in detail because the public has an insatiable appetite to learn more and try and understand what has just occurred. But the media can really be responsible in its reporting and trying not to be sensational and trying not to speculate about the potential causes, and rather wait for what's known and describe the facts as they appear.
Well, I hope that this sort of media experience is a responsible one so that we can begin a dialogue to talk about this. Certainly with younger children, I think parents have a responsibility to shield them from repeated over and over and over again exposure of things that they may be watching on TV. But I think adults have to really take that initiative and that stand with their children and talk about what it means to them, as opposed to describing the actual details and over and over again repeatedly. When violence hits home, let's say you've been part of a community that's experienced a massive violence, or of a loved one, or your family members or yourself have experienced violence. When does that become a problem? When do you think somebody or a family should get professional help if they've had exposure to something like this?
Well, there's some very simple things. I think anybody who's been exposed to a traumatic event, really ought to open themselves to the possibility that they may develop symptoms. The vast majority of people who are exposed to trauma, however, go on to adapt well to it. But it's important to reach out and support one another in the wake of a traumatic event and normalize the emotional responses that you're having. Like I said, the vast majority of people go on to reconcile the event and cope with it very well. Where you should worry is if the event doesn't seem to be able to resolve itself for you. If you're experiencing it in dysfunctional ways, disrupting your sleep with insomnia, nightmares, having flashbacks, or other anxiety or depressive symptoms. Certainly when those start to appear, those are signals that additional help would be warranted.
And you mentioned before the importance of drugs and alcohol. If you find yourself increasing the use of those things, is that another red flag?
Certainly, that's a big red flag, and actually an independent risk factor for developing post-traumatic stress disorder and other conditions. So if you're using substances to cope, that should be a really important red flag to pay attention to for you and your family.
Very, very helpful. Any final thoughts for our audience?
I'd like to leave the audience with a few thoughts.
Sure.
And primarily to address this question of bias about mental illness, that mental illnesses are brain diseases, they're treatable, treatment is available, and treatment is effective. So if our public is suffering a mental illness or knows somebody who is, please encourage them to get treatment for the condition that they're suffering. I'd also like to put a plug in for paying attention to access to firearms for people with mental illness, because more so about their risk for suicide than homicide, actually. But having access to firearms when you're suffering the acute symptoms of a mental illness is a risk factor for untoward outcome, to include suicide.
This has been so helpful. I want to thank you, Dr. John Bradley, Dr. Michael Tang. Thank you so much for being part of Physician Focus. For more information about violence and mental illness, visit the websites listed at the end of our show. And to view past Physician Focus programs covering a variety of health topics, visit our website at physicianfocus.org. I'm Dr. John Fromson. Thank you so much for watching. And on behalf of all of our members here today, we appreciate your being part of Physician Focus.
I'm Dr. Naomi Simon. The loss of a loved one affects each of us deeply and in different ways. While grief does not have a timeline and there's no single way to grieve, most of us will successfully adapt to our loss after a period of mourning. Some people, however, develop complicated grief, a clinically significant condition marked by symptoms such as severe and persistent grief, intense longing for the deceased, preoccupation with or trouble accepting the death, difficulty returning to shared activities, and a lost sense of purpose. Complicated grief can increase the risk of physical and mental illness, substance abuse, and suicide, and can interfere with the return to a satisfying life. If you are feeling persistent, intense grief over a loss, see your healthcare provider. Treatments can help this condition. For more information about a program at Massachusetts General Hospital studying the treatment of complicated grief, visit bostongrief.com.
I'm Dr. Nathan McDonald.
I'm Dr. Jeff Hopkins.
For many medical emergencies, time is critical and delay in treatment can lead to more serious consequences.
That's why we encourage you to learn some of the common warning signs and symptoms of medical emergencies that might require a visit to the emergency room.
If you or someone you're with has difficulty breathing, chest pain or pressure, sudden dizziness, difficulty speaking,
uncontrolled bleeding, persistent vomiting or diarrhea, sudden or severe pain, or is coughing or vomiting blood,
go to an emergency department. Specialists are available 24 hours a day, 7 days a week.
Remember, too, that the most important step in preparing for emergencies is to prevent them from happening, so put safety first.
And develop a plan to follow when emergencies do occur. Know your medications, medical conditions, and the name of your primary care physician.
For more information on warning signs and preventive steps for emergency medicine, visit emergencycareforyou.org.